Hello, everyone. Dr. John Bartemus here today, and I want to talk about a topic that everyone loves to talk about, and that is sex. Okay, maybe most people don't like to talk about it or are ashamed about it, but that's something we'll dive into today with our guest speaker. But I want to discuss sex because recently in my practice, actually over the long term, I've noticed a trend in women who have bared children saying that they have a low libido or have lost their sex drive altogether. And this has ranged from women who recently gave birth to a child and are in the postpartum period, all the way to women who gave birth 15 years ago and haven't regained that sex drive and that libido. And so my mind got thinking, well, why? Is there a metabolic reason or a physiologic reason? And the tightest association I can make to it is it seems to be a bigger deal in women who have given birth via C-section. So I reached out to some experts that I know in female health and pregnancy care and postpartum care to see what their thoughts were on it, because even in these women, when I'm optimizing their physiology on paper, the libido or sex drive hasn't necessarily improved. So I want to reach out to someone and say, hey, have you experienced this? And are there reasons outside of the lab numbers or outside of physiology or their metabolic system that are contributing to this? So to help answer those questions, we have Dr. Abbie Ballard back on the show today. And Dr. Abbie, thanks for being here.
Thanks for having me, John. I'm excited to be here because when I got that message from Dr. Bartemus asking me some of these questions, first of all, this is the way your provider should be thinking. So if you have a provider that doesn't go to that next step, like, well, your numbers are fine, I don't know why you don't feel any better, and they just leave it there, you need to find a new provider, because these are questions that your provider should be asking. It's not enough to just ask the what. We need to be asking the why in addition. But my response to him was, do you have time for a phone call? Because I feel like I could write a book about this.
And you should.
Thank you. So we talked yesterday about these, and I told Dr. Bartemus that sometimes the line between functional medicine practitioner or, in our case, a chiropractor can become a little bit blurred, especially as we start to dig into these complex issues. So that's what we're here to do for you guys today, to let you know that there are people out here asking these questions that understand these topics. And fortunately, I guess, or maybe unfortunately for me, I understand these on a very personal level. So we wanted to get into this discussion a little bit today so that you guys can realize you're not alone, or I guess I should say you ladies can realize you're not alone in this. And the things that you're experiencing are not just, they're not just unique to you. They've kind of become ubiquitous, and we want to explore those reasons why.
And one of the reasons why I brought Dr. Abbie on here is because she is a female. She has given birth multiple times. She has experience with this stuff personally. And again, being male, I can only, think through this and cerebrally address it, but having someone who's lived it and then obviously dealt with many women with it, I think will benefit our watchers, listeners, consumers even more. So let's start with, from a metabolic standpoint, Abbie, many women say, well, it's probably because my hormones are dysfunctional because I just had a baby and my hormones are all skewed in the postpartum period. So let's first address that postpartum period. So women who have recently had a child who are complaining of this. And what would you say in terms of their question of how much do hormones have to do with it?
Well, I can tell you guys, hormones are a big part of it, things in the beginning. Physiologically, we're changing the amount and the direction which our hormones flow because our priorities have now changed. And I have had 3 pregnancies, 4 babies. I nursed them all. So I can tell you, I understand exactly what it's like when you have been pregnant for 9 months or 9 months plus, if you were me, and then you have a baby. There's a lot of complex emotions that go along with it. And one of the first things that I talked with Dr. Bartemus about was the question itself. When we ask, like, how is your libido? I do think that there are better questions. And fortunately, again, you have a provider that, when you are a patient of Dr. Bartemus's, you have a provider that will ask you the better questions, which is, You know, are you satisfied with the quantity of sex that you're having? Are you satisfied with the quality? Are you having enough physical contact with your spouse outside of sex? Because we a lot of times will equate intimacy and sex, and they are definitely not the same thing. So whenever you've just had a baby, I understand completely what it's like for, at least in part, your body not to be your own anymore. I gave Dr. Bartemus the example yesterday of when I had my twins. So not only was I pregnant with my twins for 9 months, then I nursed them for 17 months. And while I was nursing them, I got pregnant with my fourth, was pregnant with him, and then nursed him for 15 months. So if you add all of those things kind of back to back, I had years in which I was, he's doing the math on his fingers, years during which I could never just consider what I wanted to do. It was, you know, the perfect example. I went out to dinner with a friend the other night that had just had a baby, and we went out to Mexican. And this was the first time that she and I have sat down in a long time together. And I said, you know, I'm going to have a beer tonight. And she said, ooh, I think I can maybe do one beer, like a Bud Light or a Bud Select, and that'll be okay before I have to get back and nurse the baby. So
Right.
we can really lose touch of the ownership of our bodies during that time. So not only do you have all of the, you know, the prolactin hormone that can run amok and start to mess with neurotransmitters and all of that kind of thing, your female hormones are definitely not balanced yet. So I want you guys to give yourself some grace in that period and ask yourself the better question, because we all, especially if you've been in a long-term relationship, you know that quality can matter more than quantity. So if you are not that sexually active because you just had a baby and you're exhausted, we get it. So don't judge your libido necessarily on what you think societal norms should be, because we are told you should be bouncing back. You should be right back to your pre-baby body, your stretch marks. We can put all sorts of creams and lotion and salves on those to make those disappear. We have a definite societal norm for how your body should look before babies, while you're pregnant, and then we should be able to bounce right back to that. And that's not the reality for most women.
So why don't you dig into that a little bit more, because that was, again, being male was something that I don't necessarily consider, is the fact that you're pregnant, you have the baby, and obviously we can as males see that you haven't bounced back to your pre-baby body yet, at least in the short term. But even when you bounce back, at least from the outside packaging, you may not feel that way from the inside. So talk about, you know, what you were discussing with me about being comfortable in your own skin and how there may be a delay there.
Oh yes, there absolutely is. And my husband is a super modest person, so he would probably be embarrassed that I even talk about this. But I remember when I had my first, and I was in labor. I was really overdue. I went into the hospital at 42 weeks because that was, of course, the longest you can go. They tried an induction and it failed. So I was there from Wednesday night until Sunday morning, the whole time on an IV with fetal monitors. I couldn't eat. They never let you rest. At the end of which was a C-section. And I am, of course, a very naturally minded person, and I wanted so badly to have a birth experience, and it was dramatically different from what I wanted. So not only did I have that, the best way I can describe it, and I realize that C-sections are not like this for every person. Some women are completely okay with it, but I felt like I had been completely robbed of this incredibly empowering, life-changing event. In some ways, my body had betrayed me. So not only do I have that frustration with my own body, that I was lacking control there completely of a process I really wanted to fully engage in. But now I have the stretch marks from an overdue baby. I have the sore nipples from nursing a baby that I didn't know how to lip and tongue tie. And I have a lopsided C-section scar, and I'm the heaviest I've ever been. Like all of these compounding factors. And in the meantime, my husband knows I have a lot going on, because I also, in this process, opened up my office, my own private practice. So I have all of this going on, which is enough on its own to have a new baby, to be nursing, opening a job. And then we have to take on that responsibility of also trying to meet the emotional and physical needs of a partner. And it was 4 months, I feel like, before my husband even touched me. And I finally had to be like, what in the world is going on? And I had to have that really frank discussion with him. Like, I feel like a completely different person right now. Like I don't get to make all of my own decisions. I'm on a weird sleep-wake cycle. I feel kind of detached from my body now, and I really need you to make that step, put forth that effort to let me know that you feel like I'm still desirable. Because there's no way in that recovery postpartum period, that in 4 months with all that I had going on, that I was like, 6 weeks, I'm going to be right back at the gym. That did not happen for me. And that doesn't happen for most women. So we have to make those steps proactively to have that really open communication. And husbands, I would encourage you to take that effort in the beginning, especially to let your wife know that it doesn't matter that she weighs more than she used to, or she's got stretch marks. She's still completely beautiful to you, because that will do more for libido than a lot of other efforts, really.
Right. And one thing, I'm a father of 5, and one thing I've noticed, obviously, is my wife's body isn't the body it was before the first one. But at the same time, it's beautiful, because if you think about, what women go through and the whole process of creating life and carrying life and bearing life and then feeding it postpartum. And it's like, one thing I told my wife in the past, and I wasn't in any way equating her to these people, but growing up as a kid, you saw the National Geographics, and you'd see the African ladies, with topless and like, wow, I've never seen breasts that low before, and that sort of thing. And it's like, well, now, they're that way because they successfully reared children and breastfed children and created a healthier next generation. So, yeah, maybe these females' bodies are changing, but you've done exactly what you were created to do with your body, and the way that it looks and feels afterward may not be what you're used to, but hopefully you and your husbands can look at the children and be like, this was done perfectly. Like, you don't need a nip and a tuck and a augmentation and all of that, and if you want it, that's fine, but you don't necessarily need it, because you look exactly how you should, because you successfully passed on your genes to the next generation, created a healthy child. And, that's survival right there. So to me, that's beautiful. And so we should realize that it's not Hollywood. You're not going to look the same. And like Abbie said, I think as husbands, we can be more supportive and just tell them how beautiful they are and really believe it, and help them through that process.
Oh, 100%. And it's so deeply ingrained in women that we should look a certain way, and that if we don't, we should feel some type of way about it. Like, I have heard myself say to my husband, I'm sorry about this mess of an abdomen. Like, I will do something about this at some point, I promise. I said it not that long ago. Like, I know I've got this diastasis, and it's not good. And he was like, okay, like, didn't even register for him that this should be something that he's concerned about. But it's something that women will be so deeply self-conscious of. So letting go of some of that expectation and allowing yourself some more freedom, but also being willing to have that open communication and let them be that emotional support for you. So often this is the stuff that we take to our girlfriends. And unfortunately, they tend to share the same insecurities. So then your belief system is just reinforced. Yeah, you're right. Everybody feels that their body's not good enough. Well, no, there are plenty of women out there that believe that their body is good enough. So finding those women or following some hashtags about normalizing pregnancy and normalizing birth and normalizing breastfeeding will go a long way to helping you find those women that are going to empower your belief system instead of just share those same insecurities. So that's one of the things I try to do with my patients, and hopefully we can learn to stop apologizing for our C-section abdomens.
Correct. And so how about if we move now to women who have had children, say, a decade ago, and they're still reporting that the libido or the sex drive's gone? Like last week, I had a woman in the office, and she said, I haven't had a sex drive in 15 years. It's basically, whether it's there or it's not, I don't really care. Okay. So, and if you tie back, if I dig in and I say, well, 15 years, what happened 15 years ago? That was around a childbirth. More often than not, there was a C-section involved in that childbirth. And so, how much of this is poor postpartum care by our conventional medical system? A C-section is major surgery. It obliterates your core, affects your pelvic floor. drives inflammation, all kinds of issues. So how much of it could we prevent? And then, you know, how much of those thoughts that you just mentioned postpartum, how much do they become, say, neuroplastic or ingrained, or is that internal dialogue become like a hamster wheel, so that 15 laters, I'm still not feeling beautiful, I'm still not feeling sexy, even though you may work out more than you ever did 15 years ago. You're lighter than you were 15 years ago. You're eating better than you were 15 years ago.
Oh, you know, this is why we have to ask these questions, because they're so good. And how sad is that initial phase? Like, I can take it or I can leave it. Because ultimately what you're saying you can take or leave is that intimacy with your spouse. And so that starts to beg some questions for me. Like, there is no amount of correction of physiology, of balancing of hormones, that's going to make up for a lack of interest in your spouse. Like, there's just not. And I think back to when you ask how ingrained these things can be, I think back to my mom, honestly. And this is a little different example, but my mom was a twin, and they used to joke that my Aunt Jackie had a crooked neck, like a torticollis, because mom sat on her in utero. That thought that mom was the big twin, the heavy twin, has stuck with her entire life. Even now that she's in her, mom just turned 60, she's some of the healthiest she's ever been. She's active, she's height weight appropriate, she really watches what she eats. To her, it's so easy to immediately fall back into the I'm overweight, I'm fat thought patterns. She'll say things like, oh, I hate my arms. And we do the same thing with libido and with sex drive. It's I'm too tired, I'm too stressed, there's too much going on. Ultimately, we have to be super intentional about our relationships, because there's nothing that Dr. Bartemus is going to supplement you with, or that I'm going to give you and be like, well, there's this wild yam and it's great to help do this. But I can give you all the wild yam, but if your husband doesn't touch you, or you don't touch your husband except for when it's time to have sex, I can't fix that. And some of these things become habitual. You know, you do have a lot going on. And I can tell you, as a farmer's wife with 4 boys that are 6 and under, I get being busy. I get being tired. But it's being intentional and saying you are worth the time and effort. The other thing I think about a little bit is the culture that we grew up in. And like I say, where you start to blur the lines between functional medicine support and being a practitioner there, and then asking these questions and thinking back a little bit. I am 34, so I grew up in the heart of like purity culture as far as like the Judeo-Christian perspective. And I think about women that were in my mom's generation, kind of the same thing. There was a stigma to sex. Like, if you had sex outside of marriage, you might catch a label from somebody like, oh, she's slutty, she's a whore, all of those things. And we hear that, and that gets reinforced. Oh, I have a patient at my door. Hold on just one second. I'm sorry.
Okay. So while she's seeing her patient, be thinking about, are these things you were raised in? Were you raised in a home that was religious, Christian, Catholic, whatever, that taught the no sex before marriage mantra? Not that that's right or wrong, but just think about, what did you hear continuously, and has that been ingrained in you? And in a moment, you're going to realize why that may be important currently today in affecting your libido and your sex drive and your relationship with your spouse. If we step back to the intentionality point that she made, you want to bring the same intention to your spousal relationship and your sexual relationship with your spouse as you do bringing intention to your kids and knowing where they have to be today at school, at practice, who ate, who didn't eat yet, what do you have to do around the house. Everything requires intention, and if we're not putting sufficient amounts of intention into that spousal relationship, then it's going to decay, right? If you're not putting energy into something, it's decaying. So Abbie, continue on the talk there about how our religious influences may affect this situation.
Sure. And like I said, I grew up in that heart of purity culture, where that was one of the things that was said. You know, you need to wait until marriage. Sex sort of became, at least in some ways, shameful. Like, this is something that you did if you weren't making great life choices. But the funny dichotomy of that is then we're expected to, once we're married, have this robust sex life. And now you're expecting a woman who was told, like, this is the framework for your understanding of sex, that it's at least in some ways taboo. But now I also want you to have really open conversations with your husband about these things. And I can tell you there's a lot of women who can fall into that, like, submit to your husbands. It doesn't matter if things are great for me or not. This is a role of mine. This is another job of mine. So how can you feel that your libido is awesome, you know, and things are fantastic for you if you also feel super uncomfortable expressing what you need from your partner? So this is one of the things that doesn't get talked about a lot. So if you can take it or leave it, then I can tell you things must not be great for you. And you need to have that open conversation with your spouse. And I can tell you, you know, if the 50 Shades of Grey books taught us nothing, it's that women want to be desired. You know, they want to be sought. And if we don't have open conversations with our husbands and they don't know how to meet our needs, or if you're not having open conversation with your partner and they can't meet your needs, then how do you expect that sex life to ever get better in order to drive desire? It's kind of like, and this is maybe a bad example, people hate working out, but eventually you can start to get in the habit, and eventually you start to enjoy it. You branch out, you start to explore new and different things. You can do the same thing with your sex life, and we can very much fall into those patterns and those habits, but bringing that intentionality that Dr. Bartemus and I were talking about into your relationship and go, these are the things that turn me on. And if you express that to your partner, do you think they're going to do less of those things? No, it's not the way that it works.
Not the guys I know.
So see, this is the open conversation, but it can be super awkward if you were brought up in a time in which these things are not talked about, or you grew up in a religious household where there was, at least in some ways, an aspect of shame that came along with sex. I know in, like, my house growing up, it's nothing we ever talked about. And so you have to make sure that not only are your morals passed down, but also a healthy frame of reference. Because I really think today's culture is not any better as we teach, you know, sex without intimacy is the norm.
It's flipped to the total other side of the pendulum. Now it's like promiscuity, anyone, anywhere.
Yeah. Standing up in the bathroom at a bar is what everybody wants.
Right. And sex for the purpose of sex, right? Where exactly. At least from the religious side of things, it was, this is an honorable thing and an intimate thing, and it's something to pretty much like cherry on top of the relationship. Like, there's the relationship context in sex with that. Today, it's like, you can hop on an app and have sex tonight with someone you've never met and you'll never see again. And that, you know, that's the other end of the spectrum where it leaves that essentially hole in your soul, you know, in a way. So obviously we want to be somewhere in the middle between those things. And I think as you were speaking, I think a vicious cycle could develop in the relationship. Whereas if the female doesn't have the sex drive or doesn't have the desire, and isn't bringing the intention to the relationship, so the husband approaches her and does desire her and does want it, but continues to be told, no, I'm too tired, no, I'm too tired. Well, that can become a vicious cycle where now the husband stops pursuing her because he's tired of being told no, and then she's not feeling desired because she's no longer being pursued, and that, you know, so
reinforces that belief that we're not desirable. And then in the converse, if you are with your partner and you're being pursued, but then you don't have open communication to tell them, like, this is what I like and this is what I want, and things aren't fulfilling for you, then it just becomes another chore and part of the to-do list. And again, sometimes it's hard to overcome those belief systems and those things that have become ingrained in us, to have that safe space, so to speak, to just say, like, don't do that, or yeah, that's the way we want things to go here. So when you I think sorry, just jumping in, just from the male perspective, if you're waiting till you're in the moment and you're saying don't do that, that's probably not going to be presented to me the right way. So so having the safe space and the healthy relationship these are things that probably should be talked about before you're in the heat of it, so that
you know, we've discussed like, okay, if you don't like something, tell me, and I'm not offended in the moment, right? So you've talked about it beforehand, so that when it comes up, it's like, oh, okay, slight adjust, right?
Yes, we're gonna just course correct here.
Yeah.
My husband and I were talking about this yesterday because I laughed out loud because he is a very modest person, and I said, I can't imagine the conversations that if like, honey, what's your fantasy? Anything with whips and change? And he laughed out loud at me. I was like, I know, never in a million years would this be the conversation that we would have. But these are the things that I know from my perspective go into whether or not I feel like I have a sex drive. So it becomes so much more than just how do you feel about your libido? Because when I ask that question, at the same time I'm saying, how do you feel, or what's your libido like? I'm asking you, how do you feel about your libido? How do you feel about the quality of your sex life? How do you feel about how often you're having sex? How do you feel about your body, especially now that you've had babies, and especially now that you're nursing? All of that gets wrapped up into that one question. And so it's not a surprise in any way for me to hear that Dr. Bartemus is seeing this over and over and over in his pre and post-treatment paperwork, because some of those issues, I should say maybe the bulk of those issues, are not going to be addressed by just correcting hormones alone. Some of this is psychological, some of it is emotional. That connection, again, we can't create that for you. But what we can do is empower you to say, listen, your hormones are good. So now it's time to start having these maybe awkward conversations. And, you know, if all else fails, turn the lights off, right?
Yeah, but to that point, even though the conversations may be awkward, just the fact that you're partaking in those conversations is relationship building, right? So for you to even ask the question, and even though you know Zach probably isn't into whips and chains, just throwing that out there, is kind of like an icebreaker. You got them to laugh out loud. You're a little more relaxed now. You know, humor is always good. Maybe there's an endorphin release and that sort of thing, and it's even possibly moving you closer to sex drive and to the act after the conversation. Who knows? But you're not having the conversation with the goal of having sex after the conversation. You're having the conversation with the goal of relationship building. And so
Absolutely.
even if it's awkward to have the conversation, the act of having the conversation is building the relationship and is moving you toward where you both want to eventually end up. So you really can't lose by having the conversation.
No, I don't think so. And like I say, Zach made me laugh out loud as we have this talk, because I told him about our whole conversation, and he was like, "This is really getting deep. It's been a long day. You're gonna listen to me." But made me laugh out loud because I said that to him, and he just thought I was the most ridiculous thing. I was like, I know, that's not even on your radar. He's like, no way, no. I'm like, I'm with you there, sir. No.
He's like, I'm good on the tractor. Leave the rest of this at home.
It made me laugh out loud. But.
So, Doc, as we wrap it up, do you have any finishing comments or any like really practical things? You know, A would be having the conversation and working towards comfort with the spouse in discussing these topics, and what else could the ladies do?
Okay, so there are like just some really practical things. You know, if you feel really uncomfortable in your postpartum body, then you can find practitioners to help. If you feel like you really do have an underlying hormonal issue, find a practitioner, a functional medicine practitioner, get some testing, get that corrected, eliminate that as a contributing factor. If you have kids that are little like I do, please try not to just let sex and overwhelm or stress and overwhelm be the thing that allows you to throw up barriers between you and your husband. You know, they're supposed to be our partners, or, you know, our partners are our partners in life. So be sure to ask for help. Be sure to have those really open conversations. And you, as opposed to just saying like, hey, I'm too tired. Why don't you actually explain what you feel? Like, hey, I ate, like, you deal with people with digestive issues all day. Like, I ate some food, my stomach's really upset, and I feel bloated, and that just makes me feel really not sexy right now. Like, you can say that to your husband. You can say, I tell you what, I just nursed the babies for the 17th time today, and if anybody else touches my boobs, I might lose it. Like, you can say these things, you know, so
I've been told that.
Yes.
That's a real one.
That's a real one. Yeah. You can just open those lines of communication. You can also seek out intimacy with your spouse in non-sexual ways. You know, keep that in the back of your mind too, because that can be one of those things for women. At least I know it's like, listen, you haven't bothered to hug me today. You haven't bothered to kiss me. We haven't had more than a 3-minute conversation. So no, thank you, sir. So make sure that you're connecting with your spouse in a physical way. Aside from those times that you're in the bedroom together.
And I think if I can jump in real quick, the ladies who have more recently had children or have the young kids, you know, intentionality towards a date night, you know, some frequency of a date night, once a week, once every 2 weeks, once a month. Hopefully you have some parents around or some friends who could watch the kid or kids for a couple hours so that you can have that date night with your spouse, not be interrupted by any children. Of course, you're not going to be able to go the whole time without talking about them. We've all failed that test, I'm sure.
Yeah, no kidding.
But just being separated with that one-on-one time and a date night outside your home. If you're a stay-at-home mom, there's probably some cabin fever. You'd love to get out somewhere, be in public, see other people. So make sure you're doing that.
Yeah, absolutely. My husband and I have very different personality types. So when we start arguing a lot, I know it's because I haven't spent enough time with him, which sounds like the counterintuitive, but I'm like, oh my gosh, you're so frustrating. Go on a date. You know?
Yeah.
It's the way that it is with our personality types, but absolutely making those times to connect with your spouse. Finding those women in your life that are really body positive, or maybe following those accounts on Instagram. Like, if you've just had a baby or if you're feeling bad about your body, find some body positive sites and then work into the hardcore fitness sites, because comparison, they say, sometimes is the thief of joy. So keep that in the back of your mind. There's one other that I keep forgetting.
I've got one while you're thinking. I think the 5 Love Languages book, if you've never read that, yourself and with your spouse, I think that's a great book for you both to read and to figure out each other's love languages. Because again, if mine's physical touch, and if Abbie were my wife and hers is words of encouragement, I'm living in my own world. So I'm like, hey, I know physical touch is what I want, so that's probably what she wants too. And I go at her with that, and I continually get denied, and it's like, WTF, man. But then I read the book and I realize, oh, her love language is words of encouragement and gifts. Well, if I use those things, then she is less likely to say no to me, or that's kind of a relational step towards the ultimate goal. So it may be just that, again, we're not taught the love languages growing up. If you've grown up in that Christian world, you're just told, hey, this is what you do when you're married, but there's a lot of nuance to it. And one may be you're in the same room and you've been married for 10 plus years, but you really don't even know the language that the two of you should be speaking to each other.
Absolutely. And I know mine is quality time and physical touch, and my husband's is not. He is more of a loner, so he likes individual time. That's how he recharges. So if I'm like, sit on this couch with me while I touch your head, or I'm going to rub the back of your neck while we watch this show, it can very easily be like, listen, love you and all, but I need you to get me a present, and then I just need you to like leave me alone for a little while. So learning those things, it absolutely can make a big difference. My last big piece of advice is not to let what society tells you be the marker for how you evaluate all of these things related to sex. You have to do a little bit of internal searching and go, okay, what do I want as far as quantity and quality? What might be right for one woman is certainly not going to be right for you, and it's completely okay. And you know, if any of us have been married for any length of time or in a relationship for any length of a time, we know that quantity and quality are not the same thing. So you can ask yourself those questions as well and decide what that's going to look like for you. Make that at least that part of your life can be life by design. You know, go, okay, for me to feel really connected to my spouse and to be consistently interested in them. Maybe that's sex for you once a week. Maybe it's every 3 days. Maybe it's daily. Maybe it's once every few months. It doesn't really matter to me because that's not my relationship. Whatever is right for you guys, have those honest conversations. talk about it and bring that intention again into your relationship with things like date night, with physical touch outside of the bedroom, with those conversations about what you like and what you need. And those things, the good news is they can become a self-fulfilling prophecy. The more you talk about sex with your spouse, the more likely it is you're going to have sex with your spouse. The more you talk about what you like and what you want, the more likely they're going to deliver in the bedroom. And that's going to make you more interested in the long run. So if you feel like you could take it or leave it, that's a sad place to be at and not where I want you to be, certainly. But again, make sure the physiological stuff is corrected, which is what we can help you with, and then start asking some of these bigger, kind of hairier questions.
Awesome. Well, Dr. Abbie, thank you for being here and sharing your wisdom and experience and knowledge with us. If people want to know more or hear more or reach out to you, how do they reach you?
You guys can follow me on Facebook or Instagram. I'm Dr. Abbie Ballard of Ballard Family Chiropractic. I am in Illinois. My website is just ballardfamilychiro.com. If you need to reach out for any reason, you can always email us as well, and it's info@ballardfamilychiro.com.
Excellent. Well, thank you. Any closing remarks?
No, just thank you guys again for your time and attention. I hope that this connected with some of you in a way that you're not used to. Again, I think that honest and open and kind of frank discussion is more of what we need to help this become more normal, and to let other women know what you're experiencing is not a rarity, and more often than not, it's the commonality. So if we can just talk about these things, we're going to get more complete and faster resolution of issues like low libido. So, shed your shame and embarrassment and have these really open conversations.
Excellent. Thank you. And let us know what you liked, what you didn't like, what you tried in the comments on the various platforms where you view this. And let
Nothing
us know.
too racy, guys.
Right. Don't be ashamed. Make us smile. All right. Thank you.